Hello and welcome to the presentation. Today we will be exploring cultural considerations in autism spectrum disorder treatment with an emphasis on interventions for families with differing ethnicities. The objective of the presentation today is to dive deep into the specific ethnicities of Hispanic, Black, and Asian American families regarding having a child diagnosed with autism spectrum disorder, ASD. We will be covering a multitude of topics within each ethnicity, including cultural perceptions of diagnosis, parenting style, and what each ethnicity is expecting in terms of collaboration with professionals. When working with different cultures from our own, it's important to take a step back from our own personal biases and view each family with an open mind. Culture is all-encompassing of who we are as people. It not only includes race and ethnicity, but our sex, gender, sexual orientation, socioeconomic class, religion, age, and ability or disability. As professionals, we want to make our families feel as comfortable as possible so they know we are on their team. It's important that we stay well informed and open minded in our field as it pertains to culture. Cultural competency is defined as the ability to understand and respond to various cultures and respect the diversity of the professional and client's families' relationships in which we work. If we were to treat everyone the same, we would be providing equal services, but we want to provide equitable services. Look at the leftmost image of each person standing on one box. They are being treated equally, but we would be being blind to their differences. They are different heights. If we were to treat them with equity, we would see that they are indeed different and need unique assistance to achieve the same goal, to enjoy the baseball game. Providing 0 boxes to the tallest, 1 box to the medium height, and 2 boxes to the shortest is the equitable decision. Use this image as a reminder to not treat everyone the same. Rather, recognize them for who they are as an individual and treat them accordingly. We will begin this presentation by learning about the Hispanic community in America and their journey with an ASD diagnosis. The diagnosis for an individual in the Hispanic community is generally delayed by an average of 2.5 years when compared to a non-Hispanic white child. This is due to multiple factors, the first being a lack of knowledge of mental illness. Research shows that this community did not know the word autistic before their child was diagnosed with the disorder. However, when their child was diagnosed, there was a lack of quality information in Spanish for them to turn to. Zuckerman et al. Suggest having well-translated material available at a low reading level for individuals to gather information about their child in their native language. Hispanics believe you go to the doctor when something is physically wrong with you or your child, not when your child is behaving a little odd or differently. Due to the lack of trust this community has in doctors, they turn to family members prior to going to the doctor. However, when they do go to the doctor, they run into healthcare providers not listening to them or not taking them seriously. This leads to multiple referrals before receiving a diagnosis, delaying their journey and increasing their lack of trust. In the Hispanic community, parent perceptions of their child's developmental behavior is based on their character. If the child is affectionate and loving toward their parents, they're less likely to believe anything is wrong with their child. Hispanics believe that waiting it out and providing their child with plenty of love and attention is what they need to, quote unquote, fix their problem. There are multiple barriers that the Hispanic community runs into when they begin treatment. For one, early intervention services are canceled through the state once the child reaches eligible school age. Parents have explained that they never received notice that their services were going to be canceled, and then their child was left with no intervention team until they started school a couple months later. Within this community, there are a lot of low socioeconomic and/or immigration status families that make it difficult for them to receive services in a timely manner. They are generally put on wait lists until a position opens through the state, since they don't have insurance to go to a private practice to receive assistance. This leaves the parent unsupported and the child without treatment. As mentioned in the prior slide, there is a lack of Spanish language material about ASD. When there is material, it is poorly translated and low quality, which contributes to the parents feeling left in the dark about their child's diagnosis and how they can best support them. With the Hispanic community, specifically Mexican culture, they are not very accepting of disabilities because they're not educated in them. When an individual in this community has a child with a disability, they tend to hide it from others, especially older family members, as to not cause them any anxiety. Now we will dive into the Black community in America and talk about their journey with an ASD diagnosis and the cultural perceptions surrounding them. Within the Black community, like the Hispanic community, the diagnosis is delayed by 1.5 to 2.6 years in comparison to white children. Generally, there is a lack of trust in healthcare professionals within this community, and they would rather turn to their family members for assistance before they go to the doctor. Behavior, specifically quote unquote good behavior, is extremely important within the Black community. The behavior of children is a direct reflection of the parents and how quote unquote good of a job they are doing. As we know, having a child with ASD comes with challenging behavior. In this community, it is not tolerated. The expectations of good behavior is the same for children with ASD as it is for neurotypical children. There are two universal themes that Black families live by: respect to and from others, as well as faith in God and in their family members. Within the community, once a diagnosis is received, the families are very accepting and believe that their child is a blessing. They will accommodate and support them as best they can, but the disciplinary parenting style will remain. And we will go into more depth on this in the next slide. Parenting style in the Black community is direct and authoritarian. They choose to make discipline and control at the forefront. Traditionally, Black families are known for their disciplinary actions involving physical punishment, such as a whooping. But research from Burkett et al. Shows that the latest generation has turned to less physical discipline and more verbally direct, stern tone of voice instead. This parenting style can either be a huge asset to a child with ASD due to its structure, or it can be a conflict to their social behavior. It really depends on the autistic individual. Mothers and fathers play very specific roles within the family. Assuming there is a two-parent household, mothers are the monitors of the progress in their child and want their children to be as self-sufficient as possible. They are their child's best advocates for their health, therapy, and education, while the fathers oversee their child's protection and keeping them out of harm's way. When fathers need to relinquish control to someone outside of their family, such as a therapist or a teacher, they are concerned. Building trust with both parents, but especially with the fathers of Black families, is vital for this reason. Single-parent households lean on the child's siblings as well as extended family members for support. This is something to consider when gathering stakeholder information. The extended family members should definitely be included. Respect in the Black community is extremely important. They expect to be respected as much as they show respect. When their children behave, they take that as showing respect to others. They expect their child with ASD to show respect to others by acting socially appropriately out in the community. This may be something that, as an interventionist, you will need to be aware of and be one of the first things a Black parent will ask you to teach to their child with ASD. Faith in God, but also in their family members, is close to their heart as well. They lean on their family members for support and assistance with their child with ASD and may want them to be part of the intervention process. The faith they have in God has been explained as giving them strength, a feeling of support, and hope when managing stress of caring for their child. Now we will begin to speak about the Asian American culture and their perceptions on disabilities. This community has a negative perception of individuals with disabilities, unfortunately. They attribute the diagnosis of a disability to supernatural influences or sins from their ancestors. Since this is how they perceive disabilities, they feel that they now have an obligation with this child rather than a feeling of blessing. The parenting style in the Asian community can be cold and does not change based on having a child with ASD. They favor criticism over praise, which can become difficult when an intervention needs positive reinforcement and social praise is a child's most preferred reinforcer. Like the Black community, Asian parents do not ignore challenging behavior as it reflects directly back to the parents. When the child is exhibiting challenging behavior, it appears as if the parents do not know how to discipline or parent their children properly. To avoid the humiliation, they will reprimand their children rather than ignore the problem behavior. This can prove difficult if the function of the behavior is attention, as they are reinforcing the problem behavior. Positive reinforcement is not easily approved by specifically Chinese American parents. They do not understand the reasoning behind rewarding a child with tangible items for expected behavior. Chinese immigrant parents believe that demanding parenting, which includes enforcing rules, heavily monitoring their children, and setting boundaries, results in the most positive outcomes rather than reinforcement. When collaborating with a Hispanic family, especially if their native language is Spanish, be sure to provide quality information about the diagnosis of ASD. Be open to answering any questions or clarifying information that they appear to not understand fully. Remember to be compassionate and engage in active listening. This population does not have a lot of trust in healthcare professionals. Be someone that changes their attitude and be an avenue of support. Explain to them that this diagnosis is not their fault. Within this community, they think that if they just gave their child more love or attention, that they would not have this diagnosis. And that's not true. Build trust with the family by being open with communication and arriving to sessions on time. This community has a lack of trust in services because they have been canceled on abruptly with nowhere to go. Show them that you are someone that will show up and they can depend on. If there does happen to be a language barrier, video modeling has been a proven effective way to parent train, as the parents can understand better by having a visual rather than trying to comprehend a written protocol or having a conversation about it. The video is also something that the parents can look back on while implementing an intervention if they forget what to do. When collaborating with a Black family, be sure to explain to them that when their child is misbehaving, that they are not acting out to be disrespectful. Rather, they are trying to communicate something. All behavior is communication, especially if they have a pre-verbal child. As mentioned previously, the Black community does not have a very trustworthy relationship with healthcare professionals. It's essential that you begin this relationship by being compassionate and actively listening to their struggles. Use empathetic phrases such as, "Oh, that must be so difficult," and "I'm so sorry you're going through that," to show you are someone that they can put their trust in. Be open-minded when it comes to adding their cultural disciplinary ways into your interventions. Research has shown that when interventionists creatively adapt their program, adapted their programming to fit the life ways of their family, it resulted in great success. It is vital to honor their faith in God. It has been proven successful to acknowledge and respect their faith by providing care that is congruent with their beliefs. Respect their family dynamic and integrate all stakeholders, including non-blood family members, as in their culture, each individual they surround themselves with is part of their social support system. When collaborating with Asian American families, it is necessary to explain the science behind positive reinforcement and why it is necessary in treatment. As explained earlier, specifically in Chinese culture, they do not approve of rewarding expected behavior with tangible items, and they prefer to offer criticism rather than praise. However, research has shown that the Asian community puts a lot of trust in professionals that provide education and view education and interventions for their child as very important. So, if you are to provide concrete reasoning and research facts to them on how positive reinforcement can change their child's behavior, they will be more willing to follow through. Behavior skills training, or BST, has shown to be the most effective way to train parents on implementing programs. This includes clear instruction with written rationale and operational definitions of the target skill, a written description of the intervention, modeling the intervention, having the parents rehearse or role play, and then provide feedback to the parent. When providing written rationale and description of the intervention, ensure that you translate into the parent's native language if necessary. It is important to relay to these families that their child's challenging behavior is not meant to embarrass them or cause a scene, but to communicate, especially to them. No, explain to them that especially if their challenging behavior's function is attention, that reprimanding them or disciplining them to save face in their community will only perpetuate the challenging behavior in the future. Provide replacement behaviors for the adults as well as for the children. While you may find that their views on disability are off-putting, respect their cultural views of their attribution to supernatural influences. Without addressing it head-on, it's best to provide them information on ASD in well-translated material if necessary, so they can become educated on their child's functioning. As with the Black community, find ways to incorporate their demanding parenting style into the intervention you are creating. The rules and structure may be a great thing for the child, as children with ASD tend to thrive on a consistent schedule. Thank you so much for listening. I hope you enjoyed, and I hope you learned a lot from this presentation.